The VNA health group has started this joint replacement program, and what we do is we tell them that when the day of discharge they go home, the next morning a nurse will be coming to the home to open up the case.
And when we call people a lot, they're usually really relieved to hear that someone's reaching out to them first and they don't have to call to make the schedule, because they're usually stressed when their family member is being discharged and they don't know what to do after that. So it's good for them to hear that.
The nurses are very thorough. They're going to ask you a bunch of questions about your history, medications, allergies, fall risk. They're going to do a complete assessment.
A typical physical therapy session includes combinations of range of motion, strength, balance assessments, interventions, so activities that would address any issues that were found in those examinations. We would set goals together based on what you want to do, what you need to do to get back to your lifestyle that has been interrupted by this surgical procedure.
Really have that one-on-one interaction so that they're really safe in their house.
Usually after a hospital they have endurance deficits, sometimes there's some strength impairments, range of motion, which impacts daily life, daily function. An occupational therapist provides the opportunity and the education to improve those skills and to optimize function.
I like the fact that a patient can come home and be in their own environment with their own family.
You know, when you go on a trip and you love being away and you're going on vacation, and then you get home and you go, oh, nothing like being in your own bed.
Going home is now the gold standard of care for joint replacement procedures, and it really is the best place to heal and recover.
I feel like they heal better. I feel like there's less risk for an infection.
We're actually working in your bathroom or on your stairs or in your kitchen.
I just feel like home care is a great option, and a lot of people don't know about it.
All these doctors that come to the home, that's a service that they don't know that we provide, and it's great for them to know.
The best part of home care by far is the relationships you build with a patient. When you get to work with someone in their own home, many of the barriers that exist in the medical community immediately fall away.
We're really here to really improve your quality of life, to make things better for you.
I would feel comfortable with my family member coming home and knowing that we had somebody on call 24 hours a day, 7 days a week, and that you have nurses able to do amazing assessments and call the physicians and work closely with the physicians to make sure that they're getting optimal care.
With technology advancing at light speed at this point, the technology applications and opportunities are huge.
We're doing a lot of what they call telehealth and also monitoring. We're actually monitoring patients like face-to-face, you know, when you're Skyping someone.
And we are really out there to prevent those patients from going back into the hospital and really, truly moving them forward in their care.
The more that everybody works together, the more instrumental home care will be. And I think it's going to be a big part of healthcare in the future.
Home care is the best place for patients after their joint replacement procedure. Studies have shown that infection rates are low, rehospitalization risk is very low, and the faster you can get to higher levels of care, meaning progressing from the hospital to home and then to outpatient therapy when you're appropriate, that's the best model of care that exists right now. And patients should really be aware that when you come home, you're going to get more services and not less. You're going to get personalized care, you're going to get individual attention, you're going to get care customization, because we're working on the things that are important to you and the things that are most important to you to be safe and to function in your home.
And I came back with a cane, but after the second or third day, I suddenly discovered I was forgetting where the cane was, so obviously it was becoming less necessary. I came directly home, which involved climbing 2 flights of stairs to get to my apartment, which proved to be easier than I thought it would be. The hardest thing was putting on my socks, but after the first week or so, my leg was more flexible, so I was able to do that. In my case, I was very happy doing it this way. I didn't need any convincing that it was something the way to go. So.